Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, December 13th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, we've had a lot going on here at Mass Retirees over the past 7 days. Everything from a conference to some good news on the healthcare front to some good news in terms of WEP and GPO repeal. And let me jump right into things. Now, I'll get to WEP and GPO in just a minute, but let me walk through this in chronological order, more for me to keep it all straight. So let's start with the annual fall conference of the Mass Association of Contributory Retirement Systems, which is better known as MACAS. MACAS represents the 104 public retirement systems here in Massachusetts. And in addition to being their advocacy arm and good allies of ours, they are also a vehicle for educational resources in continuing education of retirement board members and staff. And you might be aware that here in Massachusetts, there is a state law that requires that retirement board members must receive so many hours of continuing education credits every year. And MACAS is one of the statutorily approved entities to provide those education credits. So the two conferences are one of several vehicles available for this. They do an excellent job of focusing not only on the specifics of our Massachusetts public retirement systems and our unique retirement law, Chapter 32, but they also provide a broader perspective of overall retirement issues. One of the things I found most interesting was a presentation on Tuesday morning by an economist from State Street Bank here in Boston that spoke to the economic situation, the state of our economy, and the outlook through somewhat of a crystal ball, if anyone has one these days, over what's going to come next, whether it be into 2025 and 2026 and beyond. So that was a very interesting presentation. But in addition to that, our association legislative liaison, Nancy McGovern, took part in the legislative panel discussion on Monday morning, early Monday afternoon. She was joined by Patrick Charles from PERAC and Mike O'Reilly, who's the legislative chair of MACAS. Mike is also an elected member of the Boston Retirement Board. He's a Boston firefighter. Then on Tuesday, I presented the Mass Retirees update, and I want to thank MACAS President Kathleen Kiley-Bacchetti and the MACAS Executive Board for carving out some time for our association. I covered all of the relevant topics that we're most involved in right now, whether it be the COLA Commission, pension funding. Nancy and I both covered a little bit about health insurance, because even though this was a retirement conference, healthcare is extremely important and certainly a top issue right now. And then most importantly, I spoke at length about the situation in Washington, D.C. with WEP and GPO. Now, in the middle of all of this, we got word late on Monday from Wellpoint and the GIC that a tentative deal had been reached between Wellpoint and Baystate Health. Now, if you watched last week's video or read last week's email message, you know that at that time, Wellpoint and Baystate Health had reached an impasse on their contract. The current contract between Wellpoint, which of course is one of the health insurance plans offered by the GIC. They are the most popular plan with public retirees. Now, thankfully, the contract dispute did not involve the Medicare plan that is offered by Wellpoint, which is extremely popular with our members. So Medicare retirees were not going to be impacted by this situation. But that still left several thousand retirees who are non-Medicare eligible, as well as active employees in the greater Springfield area, including City of Springfield retirees and active employees who are part of the GIC. Baystate Health is the major hospital system that exists in Springfield. They also employ many of the doctors who are treating patients in and around the greater Springfield area. So any type of a contract dispute of that magnitude really has a massive impact. And you can only imagine, I know some of you watching this video are the folks who reached out to us last week. I spoke with several members directly, as did Nancy and other members of our staff, who would be directly impacted by this. And they are folks who are undergoing cancer treatment and treatments for other serious illnesses and conditions, who are panicked that their health care and their access to their local hospital, their local doctors, the folks that they trust for their care was going to be disrupted, at least potentially disrupted. And at that time, we urged Baystate Health to come back to the table, to continue to negotiate, find a solution to this problem. Now, the other main point we made last week, and that we're going to continue to meet, is that we believe that healthcare affordability here in Massachusetts has already surpassed the tipping point. It is a crisis. More and more and more of our members cannot afford additional increases in monthly premiums, co-payments or deductibles, going to the pharmacy and getting a prescription filled. For many of our members, it is extremely difficult. And we know that 40% of Massachusetts residents are choosing not to access critical health care, whether it be going to doctor's appointments or tests, going to the urgent care or the ER if necessary, or getting a simple prescription filled because you can't afford to do so. Something has to change. And we want to be part of the solution. We want to have a seat at the table. We want to help to bring healthcare providers and insurance companies together along with state officials to figure this out. And I hope that the position that we took last week of that walking away from the table is simply unacceptable helped to bring the parties back together. Because from what we understand, negotiations resumed over the weekend, and by Monday afternoon, a tentative deal had been cut between Baystate Health and Wellpoint, and a joint statement was issued later on Tuesday, and notification went out to enrollees and patients that a multi-year contract extension had been agreed upon and the crisis is averted. Now, we believe, unfortunately, that this is only the tip of the iceberg. Healthcare costs are extremely expensive. We get it. We understand that hospitals and doctors have overhead, and prices for these folks have gone up as well. But the answer isn't simply increasing prices on the people who can least afford to pay. There has to be a better way. We want to participate in that. But most importantly, right now, I want to thank Wellpoint, specifically Wellpoint General Manager David Morales, GIC Executive Director Matt Vino, and their teams for not only keeping our association well informed, but most importantly, when the crisis occurred last week, a notification went out to enrollees and patients who were going to understandably panic over the situation. Contingency plans were in place, outreach was ongoing, and for those members who directly contacted us, I can tell you that Wellpoint and David and his team were very responsive. They spoke with people individually, and things were being worked out to the best of anyone's ability to make sure that that critical health care was still going to be delivered. But thankfully, again, a deal has been cut, a multi-year deal, so we can move on, and hopefully our members are not going to be caught in the middle and treated as pawns over contract disputes. Now, no sooner did I end my speech at MACAS in Springfield on Tuesday afternoon, I jumped in the car, drove to Logan, hopped on a plane to Washington, D.C. Tuesday evening. Some of you hopefully either received the email blast that we sent out or the video I shot from the airport. We want to make sure that we're keeping all of you very well informed as to what's going on, whether it's on your health care, the COLA, or in this instance, what's happening with full repeal of WEP and GPO. Now, on Wednesday, I spent the whole day on Capitol Hill, and I was joined by quite a few of our friends and allies from here in Massachusetts, as well as my good friend Tim Lee from the Texas Retired Teachers Association. Together, we fanned out across the Hill. Not only did we meet and speak with Senator Ed Markey and Senator Elizabeth Warren, and Senator Warren participated herself in the rally, but we also met with other senators and focused specifically on Republican senators, and I'll get to that piece in just a moment. At the rally, we were very pleasantly, I don't want to say surprised, but invigorated by the presence of Senate Majority Leader Chuck Schumer. Senator Schumer attended the rally. He was the keynote speaker, if you will, and he came to deliver a simple message that he is going to call the vote on H.R. 82, bring the bill to the floor, and let the chips fall where they may in terms of passing this legislation in 2024. Now, for those of you who have watched some of the videos online, and I know a number of you were watching live as the rally was underway, you know that it absolutely poured. As a matter of fact, as Senator Schumer began to speak, I think he was about a minute into his speech, you could literally see a wall of water walking its way up Pennsylvania Avenue towards the Capitol, and the heavens opened, and it poured. And to his credit, Senator Schumer did not miss a beat. He carried on. He was followed by Senator Elizabeth Warren, who, without an umbrella or a coat in the pouring rain, delivered a very powerful, emotional call to action, not only to all of us who were there listening in and the folks at home, but more importantly to her Senate colleagues. And she was followed by Congresswoman Abigail Spanberger, Congressman Garrett Graves, Senator Jack Reed from Rhode Island was present, Senator Sherrod Brown, who's the lead sponsor in the Senate of full repeal legislation, and the list goes on. There were a host of labor leaders, both from the national unions as well as from here in Massachusetts. I was joined by representatives from the Boston Police Patrolmen's Association, the Boston Firefighters Local 718, MassCop, the Professional Firefighters of Massachusetts. I also saw representatives from the Mass Teachers Association and AFT Massachusetts and so forth. So there was a heavy presentation or representation from Massachusetts public employee unions and retirees at the rally. We were joined by hundreds of public retirees and active employees from all across the country. There were probably over 100 firefighters alone at this rally. There were countless retirees from every avenue. And despite the weather, everyone stuck it out. Everyone was invigorated by what they heard. And then we fanned out across Capitol Hill. Now, our group, which included myself, John Nelson from MassCop, who's also a member of Mass Retirees, and our good friend Paul Jakes, who's the legislative agent for the Professional Firefighters of Mass, along with my friend Tim Lee from the Texas Retired Teachers, we focused specifically on the 13 Republican U.S. senators who have publicly signed on to full repeal of WEP and GPO. Now, unfortunately, we know that the senior Republican leadership in the Senate remains opposed to full repeal, and that would be Senator John Thune from South Dakota and Senator Mike Crapo from Idaho. They're opposed to full repeal for a couple of reasons. One, the cost, and also the notion that under full repeal, Social Security benefits for some public retirees would increase beyond the point that, or beyond the level that someone actually earned, and you'd then receive an overpayment. That's what they're focused on. And despite repeat attempts to try to convince them to change their minds, they're locked into those positions. So we're just not going to get them on board. Now the question remains is, will the Senate Republican leadership, as they have in the past, take an active role to try to derail this legislation? Now, just yesterday morning, we got word from Senator Markey's office that Senator Schumer has followed through, true to his word, of advancing H.R. 82 forward. Now, earlier this week, H.R. 82 received a first reading on Monday and a second reading on on Wednesday morning, and then followed by a markup or a move to what's called a cloture petition or cloture motion. Cloture basically ends debate in the Senate. Now, Senator Schumer himself took to the floor on Thursday morning with the announcement that he was filing the cloture motion, which will bring H.R. 82 to the floor of the Senate early next week. We're anticipating a vote potentially as early as Tuesday. Now, the cloture vote is not a vote directly on H.R. 82. It is simply a vote to allow H.R. 82 to proceed forward and for a debate to take place. The cloture vote requires a minimum of 60 votes to pass. So if we only get 59 votes, the bill is dead. That's it for 2024. Everything would have to start over again next year. If the cloture vote passes with 60 or more votes, then the legislation goes to the next step, and that would be debate most likely on Wednesday of next week. Now, we will continue to be kept informed by Senator Markey and Senator Warren's offices As soon as we get word of the specific schedule of when this is going to come up, we will let all of you know, because I'm sure you're going to want to tune in, whether it's on the computer or watching C-SPAN. Any action on the Senate floor is broadcast live for all of us to watch. So hopefully we'll receive some good news. But under the rules of the Senate, things it's a pretty convoluted and slow process, and that's by design. That goes all the way back to the creation of our government under the Constitution. The whole idea of the Senate was that they were going to be a deliberative body. Things would move slowly. It's one of the reasons why senators have 6-year terms rather than 2, and those terms are staggered, that every 2 years a third of the body is up for re-election. The intent was for the Senate to act in a slow fashion, and that's what we're seeing now. And even though it's frustrating, because we would love for a bill to be brought to the floor immediately and voted upon, that's just not the way the Senate works. Now, earlier this month, I believe about 2 weeks ago or so, Senator Schumer did try to bring the legislation forward using another process, but that process requires unanimous consent of all 100 senators. And we know that Senator Crapo and a few other Republican senators blocked that movement from coming forward. They would not consent to the bill being brought up through the expedited process. Now, we're hoping that the Republican leadership will allow the cloture vote to move forward, that they will allow it to succeed, and the H.R. 82 then be brought forward for debate. Now, the rules of the debate would be the next step. We're hoping for just a clean vote on H.R. 82 up and down with no amendments. The reason for that is that if the bill receives any substantive changes, it will then be required to go back to the House of Representatives for the House to approve of those changes, for the House to concur. And that's going to take time. Time is the one thing right now that we don't have, because as you know, the Senate will adjourn a week from today on December 20th. And if the clock runs out while the bill is still in the process, that's it. It's dead. It would then have to be refiled in the next session, and the chances of success in the 25-26 congressional session are extremely remote. The Republicans will control all 3 branches of government. The House and Senate will both be under Republican control, and as I just said, the Senate Republican leadership under Senator Thune, just as it has been under Senator McConnell, is opposed to full repeal. So Senator Thune would not agree to move this legislation forward if it was completely under his control. So that's why it's so important that we get this done, that we have a clean vote, we get it to President Biden, who's already committed to signing it, before the session ends on the 20th. Now, we're going to continue to do everything we can to get this done. And as I said a moment ago, our focus this week was on the 13 Republican senators who are on the bill. We need to have them stand tall and not be dissuaded by their Republican leadership. And we had the opportunity to speak and meet directly with Senator Susan Collins from Maine, as well as Senator Rick Scott from Florida. We had great conversations with both. Senator Collins is the lead Republican co-sponsor in the Senate. She has been a staunch advocate for full repeal for more than 20 years. So we have every faith in the world that she will continue to support this effort. We also received very good feedback from Senator Scott, and he acknowledged the outpouring of support that he continues to receive from retirees living in Florida. So your calls and emails and direct communication with your senators is being heard. Every single office that we visited knew exactly why we were there, what we were talking about. No one had a puzzled look on their face. They get it. This issue has been risen right to the top in terms of people's knowledge of what's going on. Now we have to try to get it over the finish line. But we received a lot of positive feedback. We thanked those who have signed on to the bill and are doing their part to move this forward. And all I can ask of all of you is to continue to do what you've been doing. If you haven't already contacted your local U.S. senators, please do so, particularly those of you living outside of Massachusetts. We have to keep the pressure on to get this over the finish line in the time we still have left. Now, we are cautiously optimistic that we're going to be successful. I truly believe that we have momentum on our side. Once that bill successfully and overwhelmingly passed the House, it just got that inertia moving forward, and hopefully that inertia will continue to get us over the goal line or the finish line or whatever metaphor you want to use by the 20th. So stay tuned to our social media channels, to these weekly messages. Keep an eye on your email. If you're watching this video and you're not a member of our association and you're a retiree from here in Massachusetts, please consider joining. We also have an associate member program for active employees who are nearing retirement age, who want to utilize our association as a resource for information to help you better prepare for your retirement. So please visit massretirees.com. You can join by clicking the various buttons in the banner at the top of the website. Thank you so much for watching, and I hope I can bring good news to you next week on the 20th for our final message of 2024 before the holidays begin. Take care, everybody. Bye-bye.